So what is the driver? What is the tension for change in healthcare right now? The current state is not affordable for any of us, for providers, purchasers, health plans. So if we wish to survive and to thrive, we need to invent the next.
What is the state of healthcare at this point? It's volatile, it's variable, it's shifting, and really you have to stay ahead of the changes and ideally participate in those changes that are coming down the pipeline.
There are several reasons for the transformation in the delivery of care. The first group relates to quality and making that quality more consistent. The second group relates to cost and making that cost as low as it can be and still get the same outcomes. Value-based care means the highest quality at the lowest cost.
Value-based care means being able to transform care.
Value-based care for the City of Kirkland is really centered around our employees and making sure primary care is always available to them.
Value-based care means identifying and rewarding value in the delivery of healthcare. You know, the power for change for affordable healthcare comes with the purchasing power of the employers. So for a purchaser to actually use their purchasing power to drive change, they need to specify the quality indicators in their terms.
For the City of Kirkland, and for, I would think, any institution, the health of your employees is priority number one.
Through focusing on health outcomes and improving quality, we can have a return to function and getting our patients back into the workforce and contributing to the economic base of our region.
You can take action to provide value that will have a real, meaningful, measurable improvement in employees' health. And that's what we're talking about here when we're talking about improving value for employees.
The models we're using now for value-based purchasing not only take the direct costs of healthcare down, they mean that people are back to work much more rapidly with higher patient satisfaction. So what we like to say is better, faster, more affordable.
The results here at the City of Kirkland have been significant. I don't want to overstate them because we've only been doing it since April of 2015. We are not the largest sample size in the world. But we have seen an increase in utilization. We've seen a decrease in specialized referrals. We've also seen a reduction in trend. And remarkably, I think we've seen an increase in savings. Again, it's early days, but I think the principles behind the model seem to be taking effect.
Change in healthcare is difficult, but I would simply ask purchasers, are you content with the current state? If we want to invent the next, and if we want to survive and thrive, we're going to have to do something different.
You know, my advice to other organizations who are interested in pursuing a value-based approach is to reach out to the community of organizations that are doing the work now and become part of that shared practice. And take the time to learn the details, take the time to learn what's working, take the time to learn the challenges, because there are challenges. But if you get involved in that community, all of the challenges and the change seems much more manageable. And then you can start to feel and see all the powerful benefits of the value-based approach. And I think with that information and that inspiration, you will affect change.